The imaging department is being highlighted today because of our scores for Model Community Index. What Model Community Index is Ascension Health's major measurement of employee engagement. The Model Community Index is centered around 3 questions in the survey. The 3 questions are: I would recommend this organization as a great place to work to a friend or relative. That's 1. 2 is I'm overall satisfied with my job. And 3 is I plan to be working for this organization 1 year from now. The combination of those 3 questions are then an average is made for them. Nationally, there's 76% favorable for those 3 questions. For Ascension Health, it's 80% favorable. And for St. Mary's, it's 86% favorable. And for medical imaging, we're 93% favorable. So what are the reasons for the high score? I think that the reasons are both cultural and also by design. By design, administration responds to issues with the medical imaging department. One of the issues was visibility of administration. Since that was brought to light, administration is now going to almost all of our meetings now, being a presence at the meetings, responding to people's questions, making changes as necessary. As I said, our scores in medical imaging are really by design and also cultural within our department. Some of the things that we've done within the department to increase scores are not only engaging with administration, but also we developed our own little VIP program within the department. So each month there's a technical or clinical associate that's awarded the department VIP. They're given a little gift. Also, there's a support associate for medical imaging of the month, and that's something I think that people enjoy, congratulating the person and identifying those who really go out of their way. But the biggest difference that I've found in the medical imaging department is really almost a cultural difference within the department. It's something that existed here before I came here about 12 years ago, and still exists, and that's almost a sense of family and inclusion that exists in the department. Each personal milestone for an individual in the department is recognized. We've had 5 parties so far this year of people who have reached a decade of their birth, for example. We've had 3 60-year-olds within the department. We're going to have a couple of more. For some reason, it's a big year for being 60. A 40-year-old milestone. But anything that occurs in people's lives, there's somebody in the department that just grabs it and goes with it, and either has a party or a lunch or some sort of recognition. All of the recognition that's done is done organically. It's a different person each time that's honoring their coworkers. I try to help with preserve this culture by keeping my door open. Any employee within imaging or cardiopulmonary, the other department I manage, can come in and talk to me about any subject, and I try my best to get back to them with an answer. It's not always positive, but they get an answer one way or the other. Just to wrap it up, I've worked at St. Mary's for 29 years now, and it's been a pleasure working with the people in medical imaging. It's been a highlight of my career.
Why do you like working at St. Mary's?
I like working at St. Mary's, and it's proof because I've been here over 25 years, mostly because of our mission statement. We try to treat each other with compassion and care, and that boils down to the way you would want to be treated. And I see it every single day. I think the other reason we're so successful here is people are happy because they have a voice, and it's communication. And the room we're in right now is a communication room. It's called our Meetin' and Eatin' place. We refer to it as the MEP room. And we have monthly meetings. We keep each other informed what's going on in each department. We have an open forum. There's always an opportunity to say what you think could be done to maybe make your department or your area better. And that's huge because not only do you get to say it, but usually it always comes to fruition. And our CEO, Vic, comes down to these meetings, and he's just like this, you know, and his shirt sleeves rolled up, explaining what he's doing. So I think the more in know you are, the better.
I like working at St. Mary's because I feel like there's a sense of family here. Every person works really hard to make a patient feel like their family, and we definitely make sure that we kind of give everyone compassion, and that makes me feel good, and that's why I like working here. So we definitely strive for the highest level of compassion and care here, and it just makes everyone feel good, and sense of teamwork is really important. So that's why I like St. Mary's, and I love working here.